Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey El Paso, this is Dr. David, expert physical therapist. I'm the owner of El Paso Manual Physical Therapy. Welcome to the Stay Healthy El Paso podcast. I've got with me here today Philip Buckler. He is an expert dentist and has, to me, worded most clearly and most just succinctly things about dentistry that I never understood. Of course, I've grown up going to the dentist my whole life, but I love the way that Philip explains things whenever I ask him questions. Full disclosure, he's a patient of mine. He's really cool. He's had an awesome experience here at El Paso Manual Physical Therapy. And I wanted to bring him on the podcast here because he's got fantastic advice for dental health. And I wanted you guys, you listeners here, to be able to experience that from Philip. So I've got some questions for him. Before we go into that, though, Philip, please tell me a bit about yourself. Where are you from, and how did you end up in El Paso?
Okay, I'm originally from Oregon. I went to dental school in Michigan. I ended up in El Paso for my job, and I fell in love with the city and also met my wife here. So I've lived in El Paso since the end of 2011, actually, and I graduated from dental school in 2010.
Fantastic. Awesome. And of course, you've been practicing as a dentist since then. So you
yes, with a 1-year AGD residency, which is kind of an additional year of training beyond dental school.
Awesome. So you're a super dentist then.
I wouldn't go that far, but the extra training was very beneficial.
Awesome. And your experience, you've treated a variety of ages and specialties, is that right?
Yes. I believe the oldest person that I've seen was 96, I want to say, and the youngest person that I've seen, I've seen a few children as young as a few months old.
Fantastic.
Although I'm not a pediatric dentist. If a pediatric dentist tells you something that contradicts what you hear from me, go with what the pediatric dentist says with regards to children.
So I wanted to pull out of Philip here for you guys. So just clear up some general health tips, get clear on a few dental ideas, dental hygiene ideas. And hopefully this is helpful for you listeners at home or wherever you are, in the car, at the gym, wherever you're listening to this right now. One of the most common questions that I hear people talk about is, how many times a day do I need to brush? Is it just once? Is it twice? Is it after every meal? Should I be impulsive about this? What do you have to say about that, Philip?
Well, the answer to that is, for me, it's more comparable to any other area of hygiene. You just need to keep these surfaces clean. A tooth surface that is kept clean will not develop decay unless there are a large number of other factors present. But good hygiene will cover over a multitude of other potential drawbacks, either genetic or coming from, say, additional treatment like cancer, that sort of thing.
Gotcha. So if you had to make a general recommendation, we were talking a little bit before about this, you mentioned about assuming that your genetics aren't that great, so you have to just brush so often.
So assuming each surface in your mouth is cleaned at least once every 24 hours, each tooth surface is cleaned once every 24 hours, you're good. The standard recommendation is 2 brushings a day, but if you can get them all in one brushing and a flossing, say right before bed, so everything's nice and clean before you go to bed, for many people that will be adequate. Yeah. The criteria for success will vary from person to person, because the criteria for success is your teeth are staying in your head, you're not developing periodontal disease, and you're not developing decay. If you aren't developing any new cavities and your teeth aren't starting to get loose and fall out, and your dentist tells you that you're not losing bone around your teeth, then whatever level of hygiene you're practicing is adequate, or at least close enough to it for long-term sustainability to have your teeth last as long as you do.
So basically, you have to kind of figure out a little trial and error, work with your dentist to get feedback on, is what I'm doing enough?
Yeah.
Should I up it? Can I back off a bit and be okay still? That's generally how you should proceed.
Yeah, many people, if you brush and floss very thoroughly once a night before bed, that's often adequate. My wife, before I met her, she hadn't seen a dentist for 7 years, but her teeth are better than mine, and they're clean. I'm jealous. I hope our kids get her teeth. So that just kind of shows the disparity. Some people have to work at it more than others. So again, don't assume that you fall into the easiest portion of the population, because that's a good way to lose your teeth.
Yeah.
But there is a wide variability. So
I've got my wife's the same way. So when I met my wife, I had just started flossing regularly because I had the dentist tell me, you need to floss, you need to floss, you need to floss. I didn't know how to floss. I had finally had a dental hygienist take literally maybe 3 minutes, 4 minutes, and she ripped a piece of floss out and showed me do it like this. Yeah. She taught me about the hug and pull.
Yeah, using it as a scraper kind of on the inside of the teeth as opposed to seesawing back and forth.
Yeah. So you don't just get between.
There's a lot of nice YouTube videos about that too.
Oh, it's been a game changer. We taught our kids. But my wife said when she saw me regularly flossing every day, she said, "Really, you floss all the time? Who does that?" And she said, and she put her hands on her hips and said, "I've never had a cavity and I've never flossed." And I was like, "Well, I've had a lot of cavities."
I know, good for her. I'm glad she can get away with that. But most people can't. And for anyone who doesn't like to floss, then in your case, the best form of dental insurance, the best gift you can give yourself, and it will save you thousands of dollars, is a very high-end electric toothbrush. Yeah. Say a very high-end Sonicare or an Oral-B, something that will produce enough agitation inside your mouth against your teeth that it'll help kind of flush out the area in between the teeth. Yeah, that's the next best thing. And I actually have had people who use those fool me into thinking they were flossing on a routine basis, which probably doesn't impress my fellow practitioners or any hygienists, but I'm sure it's happened occasionally. They're good products, and I don't get any kickback from them. I've used both of them myself. It's just individual preference.
Yeah.
Other products that help are water picks, super floss. I'm not particularly picky about how my patients get their teeth clean, as long as they are clean and they're not developing cavities and they're not losing bone. So it looks like the bony support for their teeth will last them through the rest of their lives,
their lifetime. You know about the motorized toothbrushes. What did you call them again?
Oh, like a Sonicare or an Oral-B. Those are the two big brands, but there are a lot of other good brands.
I'll never forget growing up. And you use the same words that I've heard other dentists say, a high-end toothbrush. Yeah. And automatically when the dentist said that, I remember telling my mom that I needed a high-end toothbrush, and I got the sense of, we can't afford that. It's too high-end. And then when I actually bought my first one, I said, that was $40. Relative to a normal toothbrush is, maybe 10 times more or however many times more it is. But I got a Sonicare, and it has been one of the best investments ever. It is completely different brushing your teeth with one of those rather than a regular toothbrush. Yeah.
And as long as it prevents at least one cavity, you've more than made your money back. Or if you get one of the $200 toothbrushes, then it might take a couple of cavities prevention. Yeah. But it's an investment that will repay itself. It's cheaper. It's cheaper and more effective than dental insurance.
Oh yeah, yeah. So we started taking our kids to the dentist because they're getting bigger. They get more teeth, of course. And from the get-go, we didn't want to get them kids' toothbrushes because the brush heads on the Sonicare toothbrushes that we have are actually kind of small, smaller than the normal toothbrushes. And they fit in my kids' mouths better. Plus, they think it's entertaining that the thing buzzes in their mouth. And they loved it. So from the get-go, we started having them use the Sonicare toothbrush. And every time we take them to the dentist, they're like, "Wow, your kids' teeth look great. Their gums look great. Just keep doing what you're doing," is what they tell us. So I've loved those toothbrushes. I can't go back anymore.
Yeah, I'm going to be making sure that each of my kids has one. Yes. A good electric toothbrush, one that runs off AA batteries. It does not qualify as a high-end toothbrush. That's more of a gimmick toothbrush. Better than nothing. Don't get me wrong. Some people can do everything with a manual toothbrush. I've seen plenty of people who do that happen. But if you need that extra oomph, it'll really save you time and money, and time and pain in the dental chair.
Oh, heck yeah. That's so fun.
The dentistry is very friendly these days relative to how it used to be. Let's see. What else to talk about? Oh, yeah. So generally speaking, I tend to compare people's teeth to the treads on your tires. They will wear down over time, thousands of cycles a day, every year, all your life. Your teeth are like anything else mechanical. They're like any other part of your body. They do wear down. They will get sensitive. Some people have problems with their knees. Some people don't. It's the same with people's teeth.
Yep.
A lot of people ask me about jaws clicking and cracking and popping. Again, there's a lot of individual variation on that. I generally say that some people's jaws are more flexible than others. It's kind of like some people can crack their knuckles or make a habit of doing it.
Mm-hmm.
Again, that's an oversimplification. There's a wide variety of things that kind of go into that. But when your jaw opens, it actually goes through two forms of movement. The first is a purely rotational type of movement for the first half, and then the second half is when you're opening to your full extent.
Mm-hmm.
That is what we call a translation movement, where the condyle of your mandible is actually moving against the maxilla and physically shifting out of place rather than just rotating in the socket.
Yeah.
And to help facilitate that, your body has a disc of cartilage, like it does in many other joints in your body.
Mm-hmm.
And occasionally that disc of cartilage doesn't move optimally, or when you get older, sometimes it just wears down, period. Like in arthritis, you can get arthritis in your jaw joint. And so oftentimes that will produce a clicking, cracking, popping sound. And so most of those sounds are not something that needs to be directly addressed as long as you're chewing comfortably and functioning normally.
Mm-hmm.
Oftentimes it's just a finding to note and just kind of keep an eye on.
Yep.
But if it really is messing with your quality of life, there are treatment options.
Mm-hmm.
And I'd advise you to see your general dentist and possibly get a referral to a specialist to get that looked at.
Yeah. I think that's good. Just to summarize that in a super concise way, I think what the takeaway points from that is the jaw joints are complicated. It's not just like a hinge joint. There's a bunch of funny movements, and then just like you hear about in knees, there's a movable piece of cartilage, and their discs is what they call it, kind of similar in the spine.
And I often compare that to knees.
Mm-hmm.
It's not an exact analogy, but it's very effective.
Yeah. And so that disc can be injured, or it can shift in funny ways, and that can produce clicking sounds.
Yeah.
And even can hurt or make the jaw move unevenly. And but if basically what Philip here is saying is if it doesn't hurt or isn't affecting eating or doing anything with your mouth, then not a big thing to worry about at this point. Just monitor it, make sure it's not getting any worse.
In general, yeah. And just kind of like you would keep an eye on a knee that tends to pop when you move it a certain way, same deal with your jaw. There's actually a very in-depth subspecialty of dentists and often general dentists will become certified through additional fellowships through this, that kind of specializes in treating disorders of the jaw joint.
Mm-hmm.
And if it's really messing with your quality of life, that's when you might want to consider seeing one. However, for most people, it's that degree of intervention isn't warranted.
Yeah, it's pretty extreme.
But for those people who need it can often be very beneficial.
Yep. Super good information. I love this. The thing, just real quick, that we were talking about before we started recording here was about diet, about what you're eating and how that might affect your dental health.
Yeah, so when I see someone with good hygiene who also is developing a bunch of decay and they don't have anything in their medical history like radiation therapy that would decrease their salivary flow, then it's the typical culprit is diet. The way cavities form in your teeth, of course, like any other part of your body, bacteria like to live there. It's a nice, warm, wet environment, so bacteria like to live there even more than most places bacteria like to live. Mm-hmm. And that's why you need to clean it once every 24 hours in order to keep those bacterial colony sizes down. So whenever you put something with calories or burnable calories in your mouth, the bacteria that are living on your teeth will metabolize that, and as their waste product, they secrete acid. Now, that acid will not only decrease the pH of your saliva below the point where minerals start leaching out of your teeth, but of course they'll also do that in a much more localized, focused area on the teeth, which is why you don't want to let any bacterial colonies grow in specific areas on your teeth for any extended period of time. And a lot of areas that people miss tend to be down by the gum line, especially on the canines and second molars, because those are areas that people miss. So don't let plaque build up back there. But when those bacteria in those colonies are fed, the pH of your mouth will drop below the demineralization threshold for about 20 minutes, according to the classic studies. And every time you take a bite of something with calories, or sip something with sugar, or any other calories, not just sugar, but oatmeal is kind of another great culprit that a lot of people don't know about. That will basically restart that 20-minute timer. So as far as your teeth are concerned, it's usually not how much you eat; it's how, in terms of sugar, it's how often you eat it. If you're nursing an energy drink throughout the day, that's a lot worse for your teeth than, say, downing 3 meals a day, even if they're pure sugar. The rest of your body your pancreas would object to that much sugar,
right?
But your teeth won't have nearly the problem. So again, it's kind of a moderation thing, and unsweetened coffee, unsweetened tea will stain your teeth.
Yeah.
But if you're looking for some kind of an energy buzz or a caffeine buzz, I would suggest developing a taste for unsweetened teas, unsweetened coffees. Yeah. Because while they'll stain your teeth, they won't damage them, and they won't. And caffeine itself, in and of itself, doesn't actually lower the pH of your mouth.
That's good to know.
So it's kind of an indirect effect, but your body actually deals with that because your saliva is super saturated with minerals. When the pH in your mouth is at normal resting pH, your teeth will actually absorb minerals from your saliva, which is good in general, but at the same point in time, once they've absorbed enough minerals, you start to get mineral deposits on your teeth.
Oh, wow.
It's a very fascinating engineering trade-off.
Yeah.
You get the deposits on your teeth, but those calculus deposits will irritate your gum tissue, and of course, bacteria like to live on the calculus deposits because they're much more varied in terms of surface area, and they're harder to clean, so that tends to lead to more gum disease.
Oh, wow.
So the areas of your mouth that are most resistant to decay also tend to be the most prone to calculus buildups and bone loss and gum disease.
Oh my gosh.
And usually that's where your salivary glands empty, so there's no direct solution. It's only engineering trade-offs, and it's very interesting. And you can help that by keeping your teeth clean. Yeah. And some people with more mineralized saliva just tend to build up more calculus, so life isn't fair. Some people do need to visit the dentist 4 times a year, and some people can get away with visiting the dentist 1 time every 7 years, and they're good.
Like your wife?
Yeah, exactly.
And my wife too. Yeah, lucky. I gotta go.
Yeah.
On a regular basis, and I'm happy to. I always tell people I will use a Sonicare. I will get a high-end toothbrush. I'll floss. I'll use the water pick, whatever it is. I want to go to my grave with good-looking teeth.
Yeah, and one thing I hear oftentimes, I'm never quite sure how serious people are about this, is that they'll just get their teeth taken out and get dentures. Oh. And dentures are way better than nothing, don't get me wrong. And newer dentures that are implant supported, I'll be honest, it costs about the price of a new car to get an implant supported set of dentures. But man, they're functional jewelry that's worth it. If I ever get into a major accident and lose my teeth, I'm going to remortgage my house to get implant supported dentures, because the difference is amazing. But even normal dentures, or even like Medicaid level dentures, are still way better than nothing. But they're a learning curve. They're a prosthesis for your mouth. Wow. So you don't get the same kind of function with a denture that you would get with normal teeth. You don't get the same tactile feedback, and it's almost like wearing a custom-made pair of shoes in some ways. Wow. And your mouth changes over the course of your life like the rest of your body. And one of the things that goes on in the case of dentures is that your bone sticks around to support your teeth. When you have no teeth there, the bone will gradually remodel and recede. And so the dentures gradually become loose and fall out. So oftentimes dentures have to be remade. And by oftentimes, I mean once every 3 to 5 years, and oftentimes more, in order to keep them functioning well. And if they don't function well, if they develop sore spots, they're very uncomfortable to wear, and they can develop ulcerations. And so there is a learning curve to using them. Wow. You don't get the same tactile feedback. But again, they're a lot better than nothing. And if your dentist recommends dentures, it's probably because the health benefits of keeping your teeth in place are now outweighed by the benefits of taking those teeth out, because when teeth get loose enough to the point where you can't clean them, or the bacterial colonies get big enough, your mouth is very resilient, and it has an excellent blood flow and can bring far more white blood cells to the site than to almost any other part of your body. Wow. But at the same point in time, that bacterial load does still place stress on your body. So eventually if a tooth gets loose enough, the question isn't going to come out, but is it going to come out on your terms or its terms? And are you going to have to get it out when you have a chronic infection that's oozing pus?
Oh.
Or, yeah, I'm sorry, I don't mean to gross everyone out.
No, it's fine.
But I've seen cases. And so generally a controlled, planned removal of teeth, followed by the delivery of a prepared denture, or followed by multiple impressions to make a denture for your mouth as it is once it finishes its healing remodeling process, is a much better alternative to letting things go on their own. That being said, again, there's compromises and trade-offs, and it's everyone kind of has to decide for themselves as an individual where they're at. And of course, there's costs for dental treatment. You just have to make the best judgment call you can about how you're functioning with the teeth that you have now. If you ever have to look into that situation, or you're ever faced with that choice, see where your teeth are at now and versus where you would be with dentures, and just kind of make that call and decide when that would be right for you. And that will vary from case to case. And I see my role as a dentist is to give people the information they need to make the informed decision that's right for them, rather than necessarily dictating the decision to them. That oftentimes people ask me what the best option is. In that case, I look at their teeth and I'm like, well, if your teeth were my teeth, here's what I'd do. But oftentimes there's plenty of good options and there's a joke that if you go to 10 different dentists, you'll get 10 different treatment plans. And that's not, it's not because dentists are lying to anyone, or it's just because there are multiple ways to approach a problem. And a lot of these teeth problems are not just medical, but they're also mechanical, and there's multiple ways to get to the right solution. And dentists are individuals in terms of what works best in their hands. It's the same thing that you would run into in terms of a surgeon who recommends a particular procedure that they're very good at, which is where you get the doctor of dental surgery degree, or a different approach. And so if you're in doubt, and you're contemplating a course of dental treatment, whether it's expensive or invasive, or just because you want to educate yourself, one of the best investments that you can make is to get a second opinion. And once you find a good dentist, stick with them. And there's a lot of good dentists in El Paso, and the El Paso District Dental Society actually does have a large number of good people that I'd be quite happy to, that I know quite a few, and there's a lot of excellent dentists in El Paso, and that number is growing.
They really are. This is awesome, Philip. This has been phenomenal information. I feel like we covered the whole gamut. We talked about kids a bit. We talked about, what you should be doing normally, and then we even went into end of life dental hygiene, talking about the dentures and all that stuff. That's perfect.
Thank you for your time. I know I can get long-winded on this, and there's so much more that could be said, and people are keeping their teeth longer, and it's just great what's going on in dentistry as far as the advances that are being made even just every year. No, that's awesome. It's very exciting. Well, thank you so much for your time, Philip. I really appreciate it. Hey, everybody, for those of you listening right now, go on to the platform that you heard this podcast on. So whether that's the Apple platform, the Google platform, Android, there's tons out there. Wherever you're listening to this, if you want to get more health information, just like Philip said, so that you're in the best position to make the best decision about your health, educate yourself, and hit subscribe so that you get notified about when we put out more information, so that you can learn more about how to stay healthy in El Paso. Thank you so much, and we'll talk soon. Bye-bye. Thank you.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.